Can you correctly answer these 5 NCLEX test questions about hyperkalemia and hypokalemia? Better yet, do you want to learn to become a better test taker when it comes to these topics in nursing school? In this video, I'm going to challenge you with real NCLEX style practice videos, walk you through the best test taking strategies for nursing school, and teach you something about potassium you probably didn't know before today. If you're ready to stop memorizing and start learning to think like a nurse, then let's get started. I almost forgot. If you put the letter K down in the comments, K as in potassium, I'll send you a free copy of my detailed Silver Bullet Study System study guide that you can use to study potassium for yourself. Use it now to get comfortably passing grades on your next nursing exam, and maybe save it for NCLEX too. Let's see if you're as ready as you think you are to answer NCLEX-style questions about hyperkalemia and hypokalemia. Question number 1. A client with heart failure is receiving furosemide and has a serum potassium level of 3.0 milliequivalents per liter. Which food should the nurse recommend? This one might be a little bit on the easier side, but let's still use our good test-taking strategy, and I'm going to teach you how to do that so that you can do the same thing on your nursing exams. The one question to rule them all that we always ask before we even look at the answer choices is, what do we need to know before we can answer this question? Now, in this case, we definitely need to know what is the normal range for potassium so that we can interpret this lab result. It's also helpful to know what furosemide is, but to be honest, once you know, these two things just confirm what we are thinking as a nurse. So if you only know one and not the other, you can still get this answer correct. The other thing that would be helpful to know, since we're talking about foods, is nutrition information. What types of food are going to be high in potassium? So we know what we should choose or not choose based on that. Well, our normal lab value for potassium is 3.5 to 5. Therefore, we know that this is low. So we are dealing with hypokalemia. This is supported by the fact that the client is taking furosemide. Furosemide is in the drug class of diuretics, specifically potassium wasting diuretics. That means that this drug puts them at risk for having low potassium. Now, as far as foods go, what foods are high in potassium? Hopefully you thought of bananas. That's the most obvious one. Some others that are commonly tested on are potatoes with the skin on. Having the skin on is important. And salt substitutes. A lot of people who are taking these medications or at risk for potassium imbalances have cardiac issues also, and they might be avoiding salt. Many of these clients will take potassium chloride, which is a very common salt substitute, and not even realize it has potassium in it. Let's look at our answer choices based on what we've already been activating in our brain. We see apples, bananas, carrots, and rice. Let's be honest, this one's pretty easy. Did you guess B for banana? I hope so. This one was kind of on the easier side, but that's okay to start out easy, and it still gives us good practice thinking through things we need to know the way nurses do. Let's go on to number 2. I will be honest, with number 2, I almost got this one wrong. The nurse is caring for a client with a serum potassium level of 5.8 milliequivalents per liter. Which clinical manifestation should the nurse expect to find? One question that rules it all. What do we need to know before we can answer this question? Once again, we need to know what the normal potassium levels are. It's 3.5 to 5. We also need to know that what type of clinical manifestation would the nurse expect to find with this potassium level? We know that this potassium level is high because it is above the normal range. Therefore, we would have to think like a nurse to be able to think about what potassium normally does in the body. What is wrong right now is that we have too much potassium. So what sorts of symptoms do we expect to see because the normal job of potassium is not able to function as it is supposed to? If that sounds like a challenge for you to think, that's because you haven't been studying with the Silver Bullet study system. Because when you've been studying that way, you don't have to memorize these symptoms anymore. That's why I say this is the no memory way to get through nursing school. Let's talk through it. One simple strategy to approach answers and prevent overwhelm is by treating each one like a true-false question. We can look at this and say, is constipation an expected clinical manifestation of hyperkalemia? Yes or no, true or false? Then we support our answer using the magic word because, just like I teach in my Silver Bullet study system. You start to see how this gets easier when you've been practicing it in your study time and not only on test day. Let's think through constipation. How would constipation be affected by high levels of potassium? Well, potassium normally affects the action potentials of cells. When there's too much potassium in the blood, It makes cells easier to fire. When there's too little potassium, they're harder to fire. Constipation would be related to the smooth muscle of the GI tract. I'm thinking about peristalsis and the way the intestines move food through. If the smooth muscle is firing more easily, I think we would have diarrhea and not constipation, don't you? Because it's pushing the food through faster and more chaotically. So I think this is false. Answer B is the reason I almost got this wrong. And that's because muscle weakness is actually a symptom of both hyperkalemia and hypokalemia, but for slightly different reasons. With hyperkalemia, muscle weakness happens because all of the cell firing is disorganized. So they can't work together as a team effort to get a good contraction. Therefore, the muscles are weak. With hypokalemia, the action potential is harder to fire, and therefore it's just harder for the muscle to contract. This answer choice threw me off because I usually teach nursing students not to worry about the symptoms that are the same because you're never going to be tested on them. And I was proven wrong. But I have to say this is true because muscle weakness is an expected clinical manifestation of hyperkalemia. Just because it also might happen in hypokalemia doesn't matter in this situation. Now let's look at C. C is my best distractor on this one. And that is because we are working with smooth muscle again, just like we did with constipation. However, the smooth muscle of the circulatory system functions differently than the GI system. This makes a really good distractor because my brain is thinking cardiac symptoms often go with potassium and hypotension is related to the cardiac system. If I hadn't been studying with the silver bullet study system and gotten really clear on my rationales, I'd be tempted to choose hypotension. And I almost was, even though I was clear on my rationales. But then I asked myself, why would hypotension happen? And I realized that hypotension would happen because of the cardiac symptoms. When the cardiac cells can't contract effectively, they can't work like a team because the action potentials are firing too easily. It's just chaotic. That's going to reduce cardiac output. And reduced cardiac output is going to decrease blood pressure too, because there's less blood coming out of the heart. So that's where the hypotension comes from, but that's pretty late in the game. That's going to happen after we're having very significant cardiac problems. So that's not the first symptom I'm going to see when I have somebody with a high potassium. So I would say, yes, this happens, but I have a yes, but, which means I'm not quite as confident about this as I am with this one. So I'm going to prioritize muscle weakness above hypotension. Now, polyuria is a good distractor if you tend to get your symptoms of hyperkalemia and hypokalemia mixed up because you only memorize them and you don't really understand why they happen. Polyuria happens with hypokalemia because potassium is needed to help the kidneys reabsorb water. That's the normal function of kidneys, and they normally need potassium to reabsorb water. So if you have hypokalemia, you don't have enough potassium, the kidneys can't reabsorb the water, means you're going to be peeing it out. So polyuria is a symptom of hypokalemia for that reason. I bet you didn't know that before. And that's why the answer choice is muscle weakness. Did you guess that correctly? On to question 3, a select all that apply. We love these, don't we? No, we don't. But they do work really well with that true-false method of looking at each answer choice individually. A client is receiving intravenous potassium chloride for the treatment of hypokalemia. Which of the following actions should the nurse take to ensure safe administration of this medication? Select all that apply. What do we need to know before we can answer this question? We need to know some basics about safe IV administration, and we also need to know some basics about safe IV administration specifically of potassium chloride. So we have some generic IV considerations to think about, but we also have some that are specific to potassium chloride. Let's look at the answer options. True, false. Administer potassium chloride by IV push. Is this safe administration? The answer is no. We never administer potassium chloride by IV push because it's a very irritating medication for one thing. And more importantly, that would be putting somebody at risk for hypokalemia, which is the opposite of the problem they have now. It's very easy to accidentally push too fast, and that potassium gets into the veins faster than the body can process. So I think A is false. B, monitor the client's heart rate and rhythm. I love this answer. We already know that potassium has a high risk of cardiac symptoms because of the way it messes up the action potential. So I'm going to say B is true. C, dilute the potassium chloride in an appropriate amount of IV fluid. I like this answer too because potassium chloride is irritating. If we can dilute it, it's going to be less irritating, and it's also going to be easier to administer it slowly so we can reduce the risk of hyperkalemia. D, infuse the potassium chloride slowly using an infusion pump. I like this answer too because we're talking about giving it slowly to reduce the risk of hyperkalemia, and we're using an infusion pump, which reduces the risk of human error and me accidentally pushing it in too fast. E, assess the IV site for signs of infiltration or phlebitis. This is some normal generic IV safety, and it's even more important since we are using potassium chloride because that is so irritating. If the IV site infiltrated or we started having phlebitis, that could be really painful. And those are the correct answers, B, C, D, and E. Did you get it right? On to question number 4. A client with chronic kidney disease presents with a serum potassium level of 6.5 milliequivalents per liter. Which of the following interventions should the nurse anticipate? You know the drill. What do we need to know before we can answer this question? We need to know the normal range for potassium, which is 3.5 to 5, and that tells us that this client has hyperkalemia. It helps if we're also a little bit familiar with chronic kidney disease, but just like the furosemide problem, that's not essential. In this case, knowing they have chronic kidney disease confirms the fact that this client was already at risk for hyperkalemia, and that can make us more confident with our interpretations of this lab value. Now we just need to think through things and think what kind of interventions would we do for a client with chronic kidney disease who has hyperkalemia. And here's our answer choices. Do we administer sodium polystyrene sulfonate? Do we increase dietary potassium intake? Do we provide potassium supplements? Or do we administer spironolactone? Let's talk it through. With this question, I want to pretend like we do not know what the medications are so that I can show you a test-taking strategy for increasing the chance you still get this question right. Because while we ask ourselves, what do we need to know to answer this question in the question? Sometimes we also need to ask that in the answer options. What do I need to know whether this answer option is good or bad? In this case, we need to know a little bit about what these medications are. Let's pretend I don't. We're going to look at this and say, I don't know what sodium polystyrene sulfonate is. We're going to skip it and move on to B. So far, so good. This suggests increasing dietary potassium intake. Since their potassium is already high, this is an easy one to cross out. C says provide potassium supplements. This would have the same effect of increasing potassium in the body, which is already high. It's another easy one to cross out. Now we're left with another medication that we may not know. Even if we have to stop here, you have already increased your odds of getting this problem correctly from 25% up to 50%. I know that doesn't sound like a lot, but when you're in nursing school, those are the odds you play. NCLEX is not there to check if you know every single medication. NCLEX is checking, can you think like a nurse? And part of thinking like a nurse is using your critical thinking skills to maximize the answer choices you get correct, even if you don't know all the information. And in this case, if you knew even one of these medications, then you could narrow it down even further by recognizing if that medication would help or hurt the potassium situation, and then choosing based on that. Now that I've shown you that test-taking strategy, let me give you the information about the medications. Sodium polystyrene sulfonate is a medication that binds to potassium in the GI tract so that you poop it out. It's going to help decrease potassium in the body because it is not being absorbed into the blood anymore. It is being pooped out into the toilet. Therefore, we like this answer. It's going to help reduce the potassium. When we look at answer choice D, spironolactone, this is what we call a potassium-sparing diuretic. Its primary effect is to help the patient pee more, to get rid of water, but the mechanism of action it uses to do that serves to hold on to potassium in the body. That is not something we want to do in this particular situation. Therefore, the answer choice is A. Last one. How have you been doing so far? Do you need to redeem yourself, or are you looking for a perfect score? I want you to tell me your score when we're done in the comments, okay? A nurse is reviewing the laboratory results of a client who has been experiencing generalized muscle weakness. The results indicate a serum potassium level of 2.8 milliequivalents per liter. Which of the following is the most appropriate nursing intervention? What do we need to know before we can answer this question? We need to know what's the normal range for potassium. When we do that, we see that this is low, so we're dealing with hypokalemia. It's also helpful to know if this symptom of generalized muscle weakness is associated with the hypokalemia. If so, it supports our interpretation of these results. If not, it might indicate something else is going on. If you were paying attention to question number 2 that I almost got wrong, then you know that muscle weakness definitely can happen with hypokalemia because it's a symptom that can happen with both types of potassium imbalances, but for different reasons. So which is the most appropriate nursing intervention? A, encourage the client to increase fluid intake. B, administer prescribed potassium supplements orally. C, administer calcium gluconate to stabilize cardiac membranes. Or D, restrict dietary potassium intake. Okay, let's go through the answer choices. A, encourage the client to increase fluid intake. What will this do to the potassium levels? Whenever we are measuring blood values like this, you have to realize that this is a ratio. It's a ratio of stuff to water. In this case, the stuff is potassium particles, and the water is water, of course. Right now, we only have 2.8 particles of potassium per liter of water. That's not a lot. We want to have more particles per water. So if we add more water by increasing fluid intake without adding more particles, then this ratio is actually going to decrease, and we're going to make the hypokalemia worse. I do not like answer choice A. B, administer prescribed potassium supplements orally. I like this. It's going to add the potassium particles without adding additional fluid. So the ratio of potassium particles compared to the water is going to increase, which is going to get us closer to the normal range. B, I would say, is a good answer choice. But let's check them all just to be sure. C, administer calcium gluconate to stabilize cardiac membranes. This is another good distractor because we always know that potassium is related to cardiac symptoms. So we see cardiac membranes and we think, oh, I better deal with the cardiac symptoms because, ABCs. But this is a distractor because calcium gluconate works to calm down the action potential. If action potentials are firing too easily, then it will calm it down and make the action potentials more difficult to fire. That's a problem with hyperkalemia, but not with hypokalemia. With hypokalemia, the root cause problem we're having is that the action potentials are actually more difficult to fire. So if we give calcium gluconate, that is not going to be helpful to us right now. This is something we would do for hyperkalemia instead. D, restrict dietary potassium intake. That's an easy one to throw out because, again, it's going to continue decreasing the potassium when we want to increase the potassium. Therefore, the answer is B, administer prescribed potassium supplements orally. I want to know what your score is. Put it in the comments. Did you get all 5 correct? Did you miss one? Did you miss the same one I almost missed? Tell me. Whether you got them all right or not, would you like to get the complete potassium study guide that I created? It goes over everything you need to know for hyperkalemia and hypokalemia, gives you the rationales, and helps you connect the dots so you don't have to memorize it because you'll understand it like you would a story. All you need to do to get your free copy is put the letter K in the comments with your score. That's K for potassium in the comments, and I will give you the link so that you can download a copy of the hyperkalemia and hypokalemia study guide for yourself. Use it to study for your next test and save it to study for NCLEX later. And if you want me to talk through hyperkalemia and hypokalemia and teach it to you, then you want to head on over to this video over here because that's where I'm going to teach you that. Otherwise, you're ready to move on to the next topic and you're going to want to check out this video over here. Either way, I'll see you soon and good luck on your nursing school journey.